Robots have been used to increase precision and repeatability in every field of life so far, and it's taken a while for us to get the confidence to use it in medicine, but we have enough evidence now to use it in routine patient care, and it will unlock new aspects of outcomes for patients with hip replacements and knee replacements. What we can see here is the anatomy of the patient's knee, the bottom end of their femur here. So this is taken from the three-dimensional CT, which is done preoperatively. The system, when we come to surgery, actually knows where the patient's anatomy is. It identifies the hip, we identify the ankle, and it knows the anatomy of the knee as we identify the key landmarks. The robotic assisted arm allows us that pinpoint accuracy to essentially paint by numbers to only take away the marked areas on the preparation scan.
It only moves in a certain area by what's called haptic control, and if you get out of that window where you actually want to go, it doesn't allow you to. So the surgeon is in control, and you can see from the diagrams on the board where you are in relation to where you want to be. In terms of hip replacement surgery, it used to be that the outcome measure that you measured was how long the hip remained inside the patient. Well, we're much more interested now, not only in that, but the recovery of the patient and what function they can return to. So we want to deliver an outcome where they have what we call a forgotten hip. That is a hip like their native hip, they just don't think about day to day. And we believe that if we can more precisely carry out the surgery so that all of the muscles and the tendons are working at their correct lever arms and the center of rotation of the hip is in the correct place, then we should be able to show that the functional outcome is better for the patient and they can return to not only normal activities of daily living, but sporting activities.
It has advantages in the short term for the patient in decreased pain, earlier mobilisation, shorter hospital stay. But it also has decreased complications. It seems to have decreased readmission rates, so coming back into hospital, and it has benefits in the longer term in that the alignment of your knee replacement will be better and your satisfaction with your knee replacement will be higher.